Hey, so all welcome back to my YouTube channel. Today we are going to discuss about the cranial nerves. First of all, we have the 12 cranial nerves. You should remember their names in sequence. It is very important as all of us get difficult what is one, it is optic, it is olfactory, or it is oculomotor. So you should remember first three cranial nerves very importantly, as we often replace second by one or one by second. So remember it. So I am telling all of you about the cranial nerves. Watch it carefully and remember 12 cranial nerves along with their name. First is the olfactory, second of it is optic, third is oculomotor, fourth is trochlear, fifth is trigeminal, sixth is abducens, seventh all of you know is facial nerve, eighth of it is vestibular cochlear, ninth is glossopharyngeal, okay, 10th is vagus, 11th is accessory, and 12th of it is hypoglossal. You should remember all of these names very carefully. First is olfactory for the smell, second is optic for the vision, third is oculomotor along for the eye, fourth is trochlear, fifth is trigeminal, sixth is abducens, seventh is facial, eighth is vestibular cochlear, ninth is glossopharyngeal, 10th is vagus, 11th is accessory, and 12th is hypoglossal. Remember the names of them carefully. Okay, then the question is asked, which one is sensory, which one is motor? Okay, so I have a mnemonic that all of you, some people know that mnemonic and some doesn't, so I am mentioning it here. You can remember it with word. Some says money matters, but my brother says big brain matters more. You should remember, some says money matters, कुछ बोलते कि पैसा मैटर करता है, but my brother says big brain matters more, but मेरा भाई बोलता है कि बड़ा दिमाग ज़्यादा होना ज़रूरी है. ये तो normally all of the brothers speak the same thing, so you can remember this mnemonic very easily. Okay, now what is this? Some involves S, it also involves S, it involves M, it involves M, it involves B, M again, B, it involves S, B, B, M, and M. Basically S stands for sensory, M stands for motor, and B involves both sensory and motor. So you can remember the cranial nerves in this fashion. Okay, now I will tell you about where are these attached. As we know, we have the part of our brain, that is forebrain, midbrain, hindbrain, pons, medulla. Okay, so I am telling you these cranial nerves attach to which part of the our brain. The first two attaches to our forebrain, 3 and 4 attaches to our midbrain, and our 5 to 8 attaches to our pons, and last 9 to 12 attaches to medulla oblongata. Okay, first and second to the forebrain, third and fourth are to the midbrain, 5 to 8 are to the pons, and 9 and 12 are to the medulla oblongata. Okay, and then there is one question that is often asked, among which has the longest course and which has the largest course. Longest course, Trochlear nerve has the longest course. Okay. And facial nerve has the largest course. Remember the two words, longest and largest. Okay. Then we are going to discuss about the type of nucleus that the different cranial nerves involve. Only the important ones we are going to study here. Firstly, in the case of fifth nerve, that is our trigeminal nerve, what are the nuclei that are seen? You can remember it with a mnemonic, that is 2M and 2S. 2 stands from M and 2 stands from S. M stands for motor nucleus and mesencephalic nuclei. Mesencephalic nuclei. S stands for sensory nuclei and spinal nuclei. Okay. Now we are going to study about the nuclei of seventh nerve. Seventh nerve nuclei you can remember with MNSL. What is MNSL? M again is motor nuclei. N is nucleus of tractus solitarius. Okay. S is the superior salivatory nuclei. And L is the lacrimatory nuclei. Okay. Then we will study about the nucleus of ninth nerve. Nucleus of ninth nerve is very simple. It involves Nis. You can remember with Nis. N is the nucleus ambiguous. I is the inferior salivatory nuclei. And S is the solitary nucleus. Okay. So basically, these were the nucleus. What are the nucleus of fifth nerve? It involves 2M and 2S, motor nuclei and the mesencephalic nuclei, and 2S are the spinal and the secretory nuclei. What are the seventh? It involves MNSL. It involves the motor nuclei, nucleus of tractus solitarius, superior salivatory nuclei, and the lacrimatory nuclei. What is the ninth nerve? It involves Nis. What does N stands for? It is nucleus ambiguous. I is for the inferior salivatory, and S is the solitary nucleus. Okay. Remember this about the cranial nerves and about the nucleus. Now we are going to discuss about our fifth nerve. Our fifth nerve, that is called as trigeminal nerve. So our fifth nerve has three parts: V1, V2 and V3. We all are familiar with V1, V2 and V3. V1 is ophthalmic, V2 is maxillary, and V3 is mandibular. As I have already mentioned in the top, that trigeminal nerve is both sensory as well as mixed, but it involves three parts: ophthalmic, maxillary and mandibular. The first two parts, ophthalmic and maxillary, are only sensory, while the mandibular is mixed, that is both motor along with sensory. Okay. Ophthalmic involves the ophthalmic one, the first division, that is the V1. It involves three branches. V1 has three branches, that is lacrimal, frontal and nasociliary. Lacrimal, frontal and nasociliary branch. Lacrimal, frontal and nasociliary branch. How you can remember is that frontal is further divided into the two, that is supratrochlear and supraorbital, and nasociliary is further divided into the five, It can either be anterior ethmoidal, it can either be posterior ethmoidal, it can either be ciliary ganglion, it can either be long ciliary nerve, or it can either be infratrochlear nerve. What are the three branches? It involves lacrimal, frontal and nasociliary. In the frontal one we have supratrochlear and supraorbital. I will write full name for you. Supratrochlear and supraorbital. And in the case of nasociliary we have the five further. Firstly it is anterior ethmoidal, then it is posterior ethmoidal, then it is ciliary ganglion, then it involves long ciliary nerve, and at the last it involves infratrochlear nerve. Okay. Frontal involves the supratrochlear and the supraorbital, and nasociliary involves anterior ethmoidal, posterior ethmoidal, ciliary ganglion, long ciliary nerve and infratrochlear nerve. These are the part of V1, that is the ophthalmic one. Okay. Next we are going to study about the maxillary, that is the V2 branch. What is V2? V2 is the maxillary. Firstly, what are the structures from where it begins? Firstly, it begins from middle cranial fossa, then it goes to pterygopalatine fossa, then it goes to infraorbital canal, from where it begins from the middle cranial fossa, then to the pterygopalatine fossa, and then to infraorbital canal. Okay, so firstly the middle cranial fossa involves its meningeal branch. Pterygopalatine fossa basically involves three things. Firstly, it involves ganglionic branch, then it involves zygomatic nerve, and then it involves posterior superior alveolar nerve. Okay. Pterygopalatine fossa involves three branches, that are ganglionic branch, zygomatic nerve and the PSA block. And the zygomatic nerve involves further zygomatico-frontal and zygomatico-facial. Okay, zygomatico-facial and zygomatico-temporal. Okay, then infraorbital canal further involves the two, that are middle superior alveolar nerve block and anterior superior alveolar nerve block, and further it goes to that of face. At the face it involves palpebral branch, nasal branch and labial branch. Palpebral branch, nasal branch and labial branch. Okay, so it begins from middle cranial fossa involving the pterygopalatine fossa and to the infraorbital canal, further dividing into the middle superior alveolar nerve block and anterior superior alveolar nerve block, and further supplying to the face involving the three branches, palpebral branch, nasal branch and labial branch. From the middle cranial fossa it involves the meningeal branch. From the pterygopalatine fossa it involves the three branches, that are the ganglionic branches, that are the zygomatic nerve involving the zygomatico-temporal and zygomatico-facial and the posterior superior alveolar nerve block. Okay, the last one is the V3, that are the mandibular branch. Mandibular branches are further divided into two, that is anterior and posterior. That which divides into the anterior and the posterior, that is the main trunk. Okay, let me change the color. Okay, this one is good, I think so. Okay, from the main trunk we have two. First of all, we have the meningeal branch, and then we have nerve to medial pterygoid. Nerve to medial pterygoid. Main trunk involves the meningeal branch and nerve to the medial pterygoid. Meningeal branch involves nervus spinosus, and the anterior part basically involves all muscles of mastication. And the posterior part involves three. It involves inferior alveolar nerve, lingual nerve, and auriculotemporal nerve. From the main trunk we have the meningeal branch, that is the nervus spinosus, and the nerve to the medial pterygoid. Okay, from the anterior we have all the muscles of mastication, and from the posterior we have three: inferior alveolar, lingual, and auriculotemporal. So these were the branches of the trigeminal nerve, that are the ophthalmic, maxillary, and mandibular. Ophthalmic basically involves lacrimal branch, frontal branch, and nasociliary branch. From the frontal we have supratrochlear and supraorbital, and from the nasociliary we have the five branches, that are the anterior ethmoidal, posterior ethmoidal, ciliary ganglion, long ciliary nerve, and the infratrochlear nerve. From the maxillary we involve the middle cranial fossa, pterygopalatine fossa, and to the infraorbital canal, involving the further into middle superior alveolar nerve and anterior superior alveolar nerve, and then to the face, involving the palpebral branch, nasal branch, and labial branch. And involving in the pterygopalatine fossa we have three ganglionic branches: zygomatic nerve and the posterior superior alveolar nerve. In the zygomatic nerve we involve the zygomaticofrontal and the zygomaticotemporal and zygomaticofacial. And in the case of middle cranial fossa we have the meningeal branch. While in the third part, that is the mandibular part, it is divided into the two, anterior and the posterior. That is, the two are divided with the help of main trunk, that involves meningeal branch, that is the nervus spinosus, and the nerve to the medial pterygoid. Okay, and anterior involves all the muscles of mastication, and posterior it involves the lingual nerve, inferior alveolar nerve, and the auriculotemporal nerve. So these were about the fifth cranial nerve. Okay, so this is all about what we have studied. The most important is the fifth nerve that you should know. Rest is also important, but here I have given more stress to your trigeminal nerve. Okay, and about all the nuclei they contain. So thank you for watching. Please do like, share, and subscribe to my channel.